I'm at the Seattle Police Department's West Precinct, where Mayor Bruce Harrell is about to announce the launch of the new CARE department. It's a third public safety department, and while police will go out on a lot of the same calls, it's also, as we understand it, set up so that they don't always have to go. That different kinds of calls can be handled by the CARE department. We'll learn more about that here in just a moment.
Okay, good morning. Thank you all for being here. We're really excited to make some announcements today. Let me grab my paperwork here. So today, this morning, we're here to share the details of the vision and the timeline, the strategy, and the staffing for our CARE department, Seattle's new public safety department, as well as to announce a significant investment proposal to advance this work. Sort of a preview of the budget that we will present here very shortly, next week. The CARE department, which stands for the Community Assisted Response and Engagement Department, and I'll refer to it as the CARE department, will be a true third public safety department for Seattle. I'm very honored to be here with Chief Scoggins and Chief Diaz as the two primary public safety departments. But this vision that we are talking about in this third department is, I know, a vision shared by the City Council and the community. That's why this work is so important. Working with our police and fire departments, the CARE department will deliver on Seattle's long-standing need for a public safety system with a diverse emergency response option designed to meet community needs. And at the end of the day, we want our city and everyone here to know that we care. So to do this, I am proposing, as you will see, a 30% increase in CARE's budget in 2024. Next week, my budget proposal will include $26.5 million for the CARE department as it expands responsibilities from its current functions as the CSCC, the Community Safety and Communications Center. This investment will allow us to hire 13 additional full-time staff and make much needed technology upgrades for this kind of work and support enhanced violence prevention and intervention efforts. So CARE is built on best practices from other cities doing similar work. You've heard me talk on other occasions about some of the work being demonstrated in Albuquerque, Denver, Durham, Eugene. We will align our existing community-focused and non-public safety investments and programs into 3 divisions. The first division is our emergency call takers and dispatchers, and I'm actually going to, after this presser, I'll go and look at some of our fine employees there. Number 2, our behavioral health responders. And number 3, the third division, if you will be the community violence intervention specialists. A lot of that is community-based work, and we're doing some great work out there with some of the organizations. But all this will fall under the umbrella of the CARE department. So this will provide our city with a new crisis response alternative to non-violent, non-medical emergency calls, better helping to address the underlying health issues and better helping our neighbors in the moment of need, often in the moment of crisis. Today I can share that Seattle's dual dispatch pilot will launch in October to send CARE responders to appropriate low-risk priority 3 and 4 calls in concert with our police officers. And I'm proudly standing with our CARE response team members behind me. Very proud to uplift this work that they will make us all proud in this city. Now, we know that responding to public safety emergencies is not enough. We must prevent them before they occur. The preventative work we can't talk more about. So as part of the department's core mission, CARE will be tasked with aligning the city's violence intervention and community focused public safety programs that are currently sliced. We want all of this to be coordinated. We want them to look at how they can help one another, and we want systems improvement to make sure we're doing this work efficiently and effectively. I'm very proud to introduce the person who will lead our newest public department forward, Acting Chief Amy Smith. Amy, raise your hand so they can see you. Is it raised? Okay. Amy has led outstanding work to launch the dual dispatch pilot and brings a host of relevant skills to working with community, developing thoughtful and data-driven solutions. Prior to this presser, we released her background, which is indeed impressive, and I know we have the right person acting in this position in a road to hopefully being permanent based on the work she's already done. I want to make a very heartfelt thank you to CSCC Interim Director Rebecca Gonzalez, who's now returning to her command position with the Seattle Fire Department. I've been told she was missed, but we want to really thank her for laying the critical groundwork to put the care department on a trajectory for swift and effective service. As I mentioned earlier, I'm excited to welcome the first team of care responders hired by the city who are beginning training before the dual dispatch pilot launches in October, and let's give them a hand right now. I didn't turn around. Were they clapping for themselves? Now, these leaders will bring culturally competent, evidence-based solutions to support a safer Seattle. So I also want to share that our 911 center is on track to be fully staffed by the end of this year. So through improved recruitment and hiring and training processes, the 911 center has hired over 45 new employees in 2023, addressing a critical need and function in Seattle's emergency response system to ensure calls are answered in a timely, efficient, and effective manner. And if anyone has even watched TV to see this kind of work, if anyone has visited our 911 dispatch, this is really critical work and important work, and I can't see enough about the employees that do this day in and day out. We're so thankful for the work of our 911 call takers and dispatchers. First responders who aren't always in the limelight, but they work tirelessly every day to keep Seattle residents safe. They handle approximately 900,000 calls per year, 24 hours a day, 7 days a week, 365 days a year. They provide us with all callers access. Let me say it this way. They provide to all callers, including those who speak limited English or are deaf or hard of hearing. They have to take what is given to them to translate that into the kind of response we want to see. So we will continue to work together as we build a stronger, community-driven public safety system and a safer Seattle for all residents. Again, this will be part of the budget package that we will present next week. And with that, we'd like to have our Chief, Amy Smith, say a few words. I introduce you to Chief Amy Smith.
Now you're behind me. Okay.
Yeah.
So I thank the mayor. As a professional, I'm very grateful for a chance to do work that is so personally meaningful. But as a community member, as someone who lives in Seattle and works in Seattle and loves Seattle, I am so grateful for his vision and more specifically for his courage to act. I think it's very easy to say one Seattle. It's very, very challenging to design for one Seattle. I want to acknowledge Chief Scoggins and Chief Diaz, who have truly been partners and collaborators from the first moment. Many of their colleagues also have been supportive every step of the way to get us to this moment, and I acknowledge that, and I'm grateful. I have a nonprofit background, and so when I showed up in the public sector, I wasn't really sure what to expect. I wasn't sure if, there's some stereotypes if I was going to be met with conflict and resistance to change and maybe some intractable silos. And in reality now, after hundreds of conversations across a lot of different departments, lots of different stakeholders, community members, thought leaders, academics, lots of first responders, I think I'm standing here before you the most optimistic person in Seattle. I mean, truly. Because what I've learned is that in reality, we're all in alignment right now. I feel like everybody understands that this community needs a diversified range of responses. I feel like we seem to understand and be comfortable that we tried things that we thought would work and they didn't work. That we need to be rigorously evidence-based in our design, thoughtful and communicative as we move forward. I spent a good part of my time in 911 and then in neighborhoods. So going back and forth, what I observed is that there's a lot of pain right now in our community, and it shows up in a lot of different ways. And while there is incredible complexity in the root causes of that pain, I'm learning that there are simple and sort of elegant improvements that we can make right now that make a big difference. We can talk to each other. We can figure out who's doing what best. We can listen to those who are closest to the pain. We can coordinate our efforts. We can work together. We can be one Seattle. I was really lucky earlier this year to become involved with an initiative here in the city that seeks to provide early intervention and prevent mental health crises from escalating in adulthood. It's called Reach Out. I love this. I loved it immediately, the approach, because it involved 12 different sectors in our community and different stakeholders in those sectors. So subject matter experts, but also youth and folks with lived experience who arguably are the subject matter experts. And the second thing I loved about it was that folks would come together, the meetings were efficient, and we would leave with clear next steps and measurable goals. And I feel like that is what we need right now. So when I was asked whether the care department might be willing to promote the training design for this initiative, I said, yep, and we will. We will do that. We will improve it, evaluate it, improve it, evaluate it, and that is how we will approach everything. I have learned that change is a constant. Again, nonprofit work, human service work, it's ever changing. The challenges grow more complex. But with that opportunity comes the opportunity to embrace learning as a constant, to forge meaning through the failures. And I think that perhaps going forward, it will be not so much through the innovations and through the new programs, but through the humility and the care, the deep awareness of our interconnectedness, that we start to drive and promote the change and healing that we really want to see. Thank you.
Thank you, Chief Smith. Before I take Q&A, I'd like to give some thank yous to a few folks. Sarah Smith, for your leadership and your great research on helping us create this. Deputy Mayor Tim Burgess, thank you. Ben Dougherty, former Senior Deputy Mayor Monisha Harrell, and I want to say a special shout out to two council members standing with us right now, Councilmember Andrew Lewis and Councilmember Lisa Herbold, who we know are committed to this space, committed to this body of work. I know it because I've heard them talk about it and push us to get this work done. So thank you for your leadership and your partnership in this space. And having said that, I'll take a few questions. Good. Everyone have a great. No,
Mayor, you mentioned this similar program in.
no, he's
You
going to
mentioned a similar program in other cities. Is there any data to show how well it's worked in other cities? And also, can you give examples of what kind of calls they'll be responding to?
Sure. Good question. And I'm going to ask either Chief Smith or Deputy Mayor Tim to help me out a little bit. Burgess. So, would you like to?
Yeah. Hi. Yes, so we are looking at the first year, second year, third year evaluations for programs, especially for Albuquerque right now and Durham. Durham just wrapped up 1 year. Albuquerque just went 24/7 with their response team. They have almost 150 of these folks now, and both are rigorously evaluated. Our intention is to partner with Seattle University, with the Department of Criminal Justice. They've done a lot of really excellent evaluation for SPD, and will be good partners. We know that's important. We're going to respond to priority 3 and 4 call types. My understanding is that it's really person down where we need a lot of support. That's why we're spending a lot of time on those calls. Welfare check is managed quite well right now by fire and by police, and so we'll fill in there as we need to. But the hope is that we are really, again, rigorous in the iteration early on. We're actually talking, I talk weekly to a coordination team from PD, FD, and Human Services as well, because we want to see what's working and what is helpful. One of the key metrics in my mind in the first year is, do officers feel better? Do they feel supported? Is this useful? And so I think it'll be downstream a little bit more. We'll understand more about what the community's feeling, but initially I want to know that our other first responders think it's useful.
So I'll call one.
Oh, sure. I was just asking for explanation of priority.
An example of a priority 3, priority 4. Would you like to?
For dispatch, do you want to do it? Or?
Priority 3, priority 4 calls.
So priority 3 calls for us are typically calls that have already happened, and there is sometimes no suspect information. So a theft, a car prowl, an incident like a trespass, but the person's gone. So the things that have already happened, typically we call them paper calls that are something that an officer might write documentation of it. But we also have other calls for service that are a little bit less focused on actual criminal conduct. So as Chief mentioned, you have a person down call where the person is not committing a crime, could be highly intoxicated, might end up needing medical assistance, might need other resources or services, but that is sometimes not, we end up having to go to it, but it's sometimes calls that could actually be better handled by somebody else.
So we'll go Erica, Katie, Franklin.
This is probably also a question for the chief on those priority 3 and 4 calls. Why, if you're getting all these great behavioral health responders, why not put them on behavioral health calls specifically as opposed to, these kind of paper calls that you said in priority 4, which may be stuff that, police don't even respond to now?
Well, person down calls actually do have some components of behavioral health. Sometimes, the highly intoxicated might actually be a stem from people experiencing some level of crisis. Not always, but in some cases it can be. So having that specialty and being able to identify and work through the different resources is a component of that. We also have at the department, we also have a crisis response team that is made up of mental health professionals as well. So there will be a balance of collaboration that will also be working across not only the care department, but also the Seattle Police Department as well.
Okay, Kate.
Yeah, sort of along those lines, who would be the first point of contact if they are responding to these calls? Would it be a police officer, or would the behavioral health person take point in those situations, or would it kind of depend on the exact situation? And if there is a potential for a sort of a dangerous situation to develop, is that going to distract the officer by having to protect someone else in that situation?
Sure, please.
So to simplify, we have a really excellent co-response team right now in SPD. And so we're really taking everything that they have learned. They've been doing this kind of work really since 2012 in one form or another. And we're just expanding it to say, okay, when might police be able to arrive? We call it dual dispatch because they will arrive at the same time as our team of 2. We're actually rolling out new protocols that are more refined. They use more sophisticated technology to be able to better predict when dual dispatch is appropriate. The officer can arrive but then can leave. And the reality is, when I go on ride-alongs with co-response teams, often quickly we see it's the MHP, the mental health professional, that needs to speak. Sometimes for 45 minutes to connect someone to services appropriately and make sure things are okay. And that officer is stuck. They can't move on, and I just render there while the radio is going and calls are needed. So this is originally, the thought was just let's drive some efficiency here and make sure that people can get to more calls more effectively. Does that make sense?
Yeah. Amy, I think my question's for you too. The mayor mentioned that CARE will be basing its work on evidence-based solutions. Can we dig a little bit more, like what is that evidence, some examples of that, and how is that going to be so vital for you and your team?
Yeah, I love that question. I would have planted that question. So a lot of this work is informed actually by Transform 911 research. People starting to really evaluate call data, how many calls are coming in. And it appears that over the years, police have gone to all the calls because that's who we have to send to all the calls, right? And so they've expanded, they've upskilled, they've worked relentlessly to try to respond appropriately, but there's too many calls. And every municipality, you cannot have enough police to get to all these calls. It's just too many. So we start there and then look at the call data, and then there's just this basic question. Was police or fire required? Could somebody else get an equal response or sometimes even a better response? And so there is a national movement right now, certainly an academic movement, a community of practice, and we are all talking all the time about what we're seeing. And if you email me, I will send you like 100 resources because it's really interesting. We will start to provide public-facing data that is really tracking just a couple key metrics, and I'm doing that again with police and with fire to look at the part of our community consistently in behavioral health crisis and to make sure that we help them.
I will be emailing you. Okay.
Sarah Grace.
What's kind of the term of the pilot with this size team, and then what do you see as full-scale later?
Yeah, that might be a better mayor question, but you're doing so well, I was going to have to tackle that one. So, Deputy Mayor Burgess, I may need a little help on this because we're sort of describing this pilot, but I think there's a part that's getting buried in the work a little bit. And we're also inventorying every department, every group, all our city employees are gonna work collaboratively with them in the next 2 years, see who touches this space a little bit. And is this a fit under the care department? So we haven't started those discussions. And so part of our pilot, if you will be, and in that sense, to answer your question directly, the pilot could be a pilot, quote unquote, for the next year to two. Only because we want to see where it makes sense. We want to see where the data leads us. So I guess an example would be in different departments, you look at the HSD, we have community-based organizations doing some work that one could argue is critical public safety work. So we'll evaluate should those contracts be under this particular group. We haven't made those decisions yet. So to describe a term of a pilot, this is, as Chief Smith said, this is ongoing sort of data gathering work for the pilot. So I don't have a hard cutoff, but maybe if anyone wanted to, that's pretty darn good answer, I have to say myself. So but that's how I'm sort of looking at the pilot when I asked my team the same question. So that's sort of how we're going to go about it.
Okay, Erica?
You signed the legislation yesterday on controlled substances, and it talks about diversion. I'm wondering if you can preview what you're gonna put in your budget for diversion and treatment programs.
I wasn't quite prepared to answer that one, Erica.
Yeah, we'll answer that one on Tuesday.
I don't have a great answer to tell you on that one.
This administration is committed to diversion, and we'll see that reflected in the budget.
To follow up to that, I mean, is the priority for calls, I'm still not clear, that include substance abuse, would that include, drug overdoses, not
So I've learned a lot this year, and I've learned priority 4 really doesn't mean what we thought it means. You know, I mean, the chiefs can tell you these are often, my understanding is like parking issues and noise complaints. So I think it's gotten rolled in because a concern about noise, that might be really appropriate, right, for this team. Generally, it's priority 3. That's what we're talking about. These are low acuity, and again, we will be really rigorous, the way we already are in dispatch, to ensure that there is really no threat of violence. What's interesting, when you talk to mental health professionals, we're already out in this work all the time. We're doing street response, we have secondary response. And so it's already, that risk is already really well managed. And I hear sometimes the concern that social workers are gonna get shot, but this is not happening because we're so thoughtful about that initial point of contact in 911. You can email me too.
Yeah, so you're saying they're already out there, so you're prioritizing other different kinds of calls for.
One of the innovations right now is that we have all these secondary response teams, and they will become primary responders. This group can go out, they can be dispatched. But the body of work has existed, we've been doing it well.
And so are police saying that this is what they need, this is why you're going in this direction?
Chief Barton, Chief, yes.
We know that staffing is a challenge. We know that we're having a hard time being able to reach all the, it's not usually the priority 1 calls are an issue. Even priority 2 is not an issue, but once you start to get to priority 3, that does become some of an issue where there's a response time can take up to, an hour, if not longer than that. And so for us to have other resources that can also be able to manage and handle some of that work, we were really extremely interested in being able to do that because it makes the whole city much more responsive. So we are looking at what she referred to as low acuity calls, really calls that sometimes don't typically need a police presence. We've done that with our risk management demand work, where we've actually been able to assess all sorts of different calls for service to find out, once the final deposition or disposition of the call is, could it be another better spent putting another group to be able to handle that. So we're right now, you start to think about, okay, what does an officer respond to? What does an officer and a community response work look at? And then what are community responders only look at? And so really we're trying to fill those buckets to make sure that we're responsive to all of them.
Sarah Grace?
Can you kind of explain the chain of command, who's going to be over this team and the care department? And specifically, can you speak to if there's been turnover? Is Reba Gonzalez still involved?
The last person, Sarah Grace?
Is Reba Gonzalez still involved?
Oh, very good. So chain of command, these 3 chiefs report into Deputy Mayor Tim Burgess, and Rebecca was the interim. She will return back to the fire department as deputy chief. And I hope I thanked her for laying the foundation for what we're doing. And our acting chief will be Amy Smith right here. want to mention, I think I'll take maybe one more question, that I don't know if you know, but our 911 center is in this building. That's why we're here. And I will invite members of the press, if you'd like to tour it with us when we leave here, you're more than welcome. So any last question before I do the Harold countdown? 3, 2, oh, you got it.
Yeah, just a question, just to ask, that I have you in the room. You know, you talk
Sounds
about.
off topic, go ahead.
You talk about a safer Seattle for all residents, and of course, me and some of my peers are trained to be 911 dispatchers. That's why we're here, and it's. You know,
You're in training now, or you're actually?
Yeah, training to be.
Yeah.
So working on it.
Good.
But one of my questions is just like, how are community members, you know, supposed to feel safe when the Office of Police Accountability, for example, the case of Kevin Dave like running over, hitting a pedestrian, and it's been months since it was finally released, and they're not fired. I mean, like, how are we talking about a safer Seattle when the Office of Police Accountability, like, how many months do you need to decide on what happens to take action on something like that?
You know, thanks for the question. So, first of all, there's certain things as the mayor, I can't comment on ongoing OPA investigations, and in that particular situation, even the King County prosecutor are evaluating that to see if there was any criminal culpability in that action. So that's the context with which my remark is made. That we spent a lot of time, by that I mean decades, addressing an accountability system. That in that situation, even the body camera footage that was surfaced for the whole world to see was a result of putting systems in place to highlight that kind of work. But I've said publicly that part of my job as mayor is to go out there and build community trust that can be adversely affected by what we're seeing. But everyone's entitled to due process. The attorney in me values due process, making sure the systems we've designed work. And if the systems don't work, then I have council members working with the OPA, working with the sort of 3 or 4 tiered levels of accountability, then we improve them. So the process is working. Sometimes justice is not quick. Due process sometimes is not quick. Certainly not as quick as people would like it to see. I understand that. But everyone accused of misconduct has the right to due process, and I will defend that process. You can't be quick to judgment, because I will share with you that when a society becomes quick to judge, we have people who are unfairly castigated and incarcerated. I have a member of my administration who was sentenced to prison for over 20 years without the possibility of parole, was unfairly convicted because of the lack of due process. So I'll defend due process, part of our society, but I have to build trust. And it's unfortunate in that situation, it's unfortunate that we're still having discussions about it, and hopefully we'll see outcomes and people will say, you know, the system, perhaps slow, the system worked. And that will be the outcome that I think my administration will be pleased with. Thanks for the question. And thanks for being part of this work as well. Okay, so it's tour time. If you're so inclined, we'll take a minute or two to let you get set up and we'll go see.
The mayor and his team are getting a tour of the 911 center.